Hello, everyone, and welcome to the webinar presentation, High Dose Vitamin C and Breast Cancer. My name is Susan Valakis, and I'm the Training Development Coordinator with NOW. And in today's presentation, we will examine the accumulating medical research showing that vitamin C may be valuable in the fight against breast cancer. Although high-dose vitamin C is not part of the traditional medical approach to breast cancer, there is evidence of its benefit. High-dose vitamin C seems to be directly toxic to breast cancer cells and also prevent metastasis and growth by cancer stem cells by regulating inflammation pathways. Today's webinar is hosted by Natural Health Research, which was founded by the late Elwood Richard. Natural Health Research is a nonprofit organization that provides scientific evidence on the benefits of natural food, supplements, alternative medicine, and lifestyle to improve health and well-being. If you would like to be part of supporting the mission for Natural Health Research, you may make a donation in any amount by visiting naturalhealthresearch.org and clicking the donate link at the top of the page. And while you're there, you can search over 3,000 peer-reviewed articles on various natural health topics to help you stay informed and up to date. Before I introduce our guest speaker for today, just a few housekeeping matters. We will not be taking questions today, but if you do have a question, please feel free to use the chat bubble on your screen, submit your question, and then we will reply to you by email with the answer. And also, about an hour after today's presentation, you will receive an automated email with a link to the replay of this presentation in case you want to hear it again or share it with others. And with that said, it is now my pleasure to welcome Dr. Patrick Massey for today's presentation on high-dose vitamin C and breast cancer. Dr. Massey received his medical degree from Rush Medical School and completed his residency in internal medicine at Rush Medical Center. His PhD is in immunology from Northwestern University Graduate School of Medicine. And Dr. Massey also has a doctorate in spiritual studies from Delphi University. Currently, he is the president of AltMed Medical and Physical Therapy Integrative Medicine and the author of Miracles, or I Have No More Boils. Dr. Massey is also on staff at the Alexian Brothers Medical Center, and he is the past director of the program in complementary and alternative medicine for the Alexian Brothers Hospital Network. He is a longtime featured writer for the Daily Herald newspaper, and he has also published extensively in the traditional and non-traditional medical literature in both laboratory and clinical research. So with that impressive resume, please join me as it is my honor to welcome Dr. Patrick Massey for today's presentation. Welcome, Dr. Massey.
Yes, hi, Sue, and thank you for that introduction. I want to welcome everybody here for the seminar. Some of you may know me, some of you may not. I also want to thank the Natural Health Research Institute and Now Foods for making this seminar possible. Not just now, but it's I believe it's being taped and is accessible for those who couldn't make it today. We're going to be talking today about breast cancer and high dose vitamin C, which usually is a topic of great controversy in among oncologists as well as non-traditional practitioners, but there is accumulating medical research and medical evidence showing that high dose vitamin C may be very important in the treatment of breast cancer. So first off, let's get some housekeeping things done. There we go. Oops, let me back up. This lecture is not meant to diagnose or treat any specific medical condition. It's for educational purposes only. Let's get everybody on the same page, and we'll start with breast cancer itself. Breast cancer is a serious medical condition. It's the #2 cancer found in American women. The number 1 cancer is actually skin cancer. In the U.S., 1 in 8 women will be diagnosed with breast cancer in their lifetime. That to me is a scary number. It is the number 2 cause of cancer-related death. The number 1 cause in American women for cancer-related death is actually lung cancer. The incidence of breast cancer is increasing about 3% per year. This could be because of environment. It could be because people are living longer. But the bottom line is that it's happening more often. And the annual cost for treatment in 2023 for breast cancer was somewhere between 28 and 35 billion dollars, depending upon how you add up all the numbers. So it's a really big deal. So when we look at risk factors for breast cancer, there are a number of them. Age is number 1. As women get older, there's an increased risk of breast cancer. But interestingly, as women get older, the aggressiveness of the breast cancer becomes less. So if you get breast cancer at a young age, it can be very aggressive. At an older age, not so much. Alcohol consumption is another risk factor, and this would be regular alcohol consumption. Interestingly, the amount of alcohol that your cardiologist says to drink every night, glasses of red wine and whatever else to improve, to reduce your risk of having a heart attack, is the same amount of alcohol that increases your risk for breast cancer. Inactivity is absolutely huge. Women who are more inactive have a significantly greater risk for a variety of reasons. As a matter of fact, being physically active reduces your risk of almost all chronic illness and disease. So that's really kind of a universal thing. This is something that is becoming increasingly bothersome, is that being overweight or even obese is also a significant risk factor for breast cancer. Fat cells are not just there storing fat. Fat cells also make estrogen and other hormones that can increase the risk of breast cancer. I think I want to say 54% of the U.S. population is overweight, and of that 50 some percent, 32 or 33% of them are diagnosed as being obese. This is a risk factor that is actually easily modifiable. Also, family history is important. If your mother had breast cancer and your sister had breast cancer and your aunts had breast cancer, you're at significantly increased risk of having breast cancer. Genetics also, we're finding different genes increases the risk. The BRCA1 gene, the BRCA2 gene are examples. And having your first pregnancy after 30 and not breastfeeding. So it will increase your risk of having breast cancer within your lifetime. So what causes breast cancer? If you were to get 10 doctors in a room, you get 10 oncologists in a room, and you say what causes breast cancer, you'll probably get 12 different opinions. And really the bottom line, beyond the genetics and beyond the other risk factors, the obesity and the alcohol and the age, the thing that really causes is the instigator and promoter of breast cancer is chronic inflammation. And this is really the instigator and promoter of almost all chronic diseases. Autoimmune disease, type 2 diabetes, heart disease, Alzheimer's has to do with chronic inflammation. There's a specific pathway that seems to be critical, especially in breast cancer, and this inflammatory pathway is called the NF-kappa B pathway. And we'll be talking more about this because this is going to be an area where high-dose vitamin C has an impact. There are a number of other inflammation factors that are involved that affect the transformation of normal cells into tumor cells. These inflammation factors also will decrease the activity of the immune system. It's not uncommon for breast cancer tumors to actually have white blood cells in the tumors, not recognizing or doing anything about the tumors that are there. Okay, there is a transformation that happens of the cells that is important for metastasis, and this is called an epithelial to mesangial transformation, and I'm going to talk about this a little bit later, so don't worry about it right now. And what happens is that with this transformation from epithelial to mesangial cells, there is an increase with resistance to chemotherapy and radiation. And this is the main thing here is what makes breast cancer so deadly. So there are two aspects to breast cancer. One is the primary tumor, the primary tumor mass. It's primarily epithelial, and interestingly, it's actually relatively stable. Now, in that primary tumor, it's not just made up of one specific type of tumor cell. There's a whole family of close lookalikes that are growing inside of that primary tumor, and we treat these these tumors in general with surgery and chemotherapy and radiation therapy. And if we can catch the tumor early enough, surgery can be curative. If we catch the tumor later on, then we need to add chemotherapy and radiation therapy because of these cells here, cancer stem cells. Now, I'm sure many of us have heard about stem cells and stem cell transplants and all these wonderful things that stem cells can do. Cancer also has stem cells, and these these cells are mesangial in origin, and they're migratory. These are the cells that will start to metastasize, and these are the cells that really in breast cancer or any kind of cancer, it's these cells that are causing all the problems. Not so much the primary tumor. In traditional medicine, we have nothing. We have nothing to treat cancer stem cells with except radiation therapy and chemotherapy. And cancer stem cells very rapidly will develop resistance to radiation therapy and to chemotherapy. We have nothing specifically for these cells. So let's talk about vitamin C for a second. It is the most common supplement used by breast cancer patients, and it's also the most common supplement used by breast cancer survivors. So whenever I see cancer patients, even though they're coming for me for specific advice, by the time they get to me, many of them are already doing vitamin C, because you can Google breast cancer, and there are probably a million sites where that are saying that vitamin C is good, and so there is a perceived benefit, and this perceived benefit is actually quite real, as we're going to see in just a minute. So the use of high-dose vitamin C or ascorbic acid in cancer really began with two research, Ewing Cameron and Sir Linus Pauling. Sir Linus Pauling was a two-time Nobel Prize winner, and they did some interesting research that was published in the Proceedings of the National Academy of Science in 1976. And what they found is that high-dose vitamin C treatment of terminally ill cancer patients. These are patients that were basically in hospice. That the treatment of terminally ill cancer patients, breast cancer patients, increased survival four times compared to those who were not treated. So the average length of survival for the treated patients was 210 days, and the average length of survival of patients who were not treated was 50 days. This study was met with great derision and animosity in the traditional medical community, and the response to this probably set high-dose vitamin C research back 50 years. So let's just talk about vitamin C for a second. Vitamin C is not a vitamin. It's a cofactor that's necessary for many metabolic processes in your body. A vitamin is something that is used in a tiny amount as a cofactor or a coenzyme. Vitamin C is used in quite large amounts on a daily basis. Excuse me. It's interesting in that vitamin C has two properties. We think of it as an antioxidant. So I'll say take your vitamin C. It's a very good antioxidant. But at high doses, it loses this property of being an antioxidant and becomes a pro-oxidant. So an antioxidant would prevent rust from forming on your car. A pro-oxidant would stimulate rust forming on your car. But it's this pro-oxidant form that seems to have the greatest benefit in breast cancer. in that it has direct actions against breast cancer, and more importantly, against breast cancer stem cells. It seems to be quite toxic for it. It actually may enhance certain chemotherapies. We'll see that a little bit later on. So the idea in traditional medicine that taking vitamin C, the concept is it's an antioxidant and it's going to counteract chemotherapies. That could be true if you're taking a small dose, but at a high dose, it actually makes cancer cells weaker, and so chemotherapy becomes more effective. It is unlikely to negatively affect radiation therapy on the same basis. So if a tumor cell has been weakened by high dose vitamin C, hitting it with a little radiation is going to be so much more effective. And interestingly, cancer patients seem to be often deficient in vitamin C. So most animals make vitamin C primarily in response to stress. However, tarsiers, monkeys, apes, humans, bats, capybaras, and guinea pigs do not make vitamin C. In humans, we have the genes for it, but for some reason, in most people, these genes are not turned on. If we look at apes, if we look at a gorilla and we see how much vitamin C they take in their normal diet, and we kind of ratio it to a human, we should be consuming about 5,000 milligrams of vitamin C a day. And I don't know very many people who take 5,000 milligrams of vitamin C on a daily basis. This is also a possible confounding factor in cancer research. Mice and rats make more vitamin C when they're stressed. So if you inject these animals with cancer cells, or if you treat these animals with chemotherapy, they're going to start making more vitamin C. And this affects placebo-based research in that it may artificially enhance chemotherapy results. And we see this. Things seem to work better in animals than they do in clinical trials, and this may be one of the reasons. So what is high dose vitamin C? High dose vitamin C is given intravenously versus orally. It's usually more than 10,000 milligrams or more intravenously, as opposed to 500 to 3,000 milligrams orally. It's given 1 to 2 times per week, as opposed to something given daily. It's a supplement. They're both supplements. Intravenous vitamin C has to be given under the direction of a physician. And if you're taking it by mouth, no physician direction is needed. It's a pro-oxidant at the high doses, and it's an antioxidant at the lower doses. So high dose vitamin C, we would think of it as kind of an alternative therapy. However, it's not new and it's not alternative. High dose vitamin C was first used in traditional medicine many years ago. In 1949, excuse me, a paper published in the medical journal Southern Medicine and Surgery demonstrated that the treatment of polio and other viruses with vitamin C was quite effective. In this study, there were 60 children with polio, of which 100% of them had cure with the treatment of intravenous vitamin C. The vaccine for polio didn't come out until the early 1960s. So this really was the only treatment for polio. It was not readily available, and unfortunately, many young folks ended up in iron lungs. In 1955, the Annals of the New York Academy of Science again looked at the research of hesperidin, which is a bioflavonoid found in fruits and vegetables, and ascorbic acid in the management of polio, again showing a real positive benefit with it. In 1955, in the American Journal of Digestive Diseases, they talked about the use of citrus bioflavonoids in infections. If you have a viral infection, drink some orange juice, drink some, have some oranges or whatever else was a concept. In 1956, in the very conservative Journal of the American Medical Association, discussed the usefulness of these bioflavonoids and ascorbic acid in treatment of the common cold. It actually works. So if you have a cold, if you have a common cold, having fruits, having a lot of vitamin C and bioflavonoids does shorten the course and the intensity of the common cold. And then in 2021, which doesn't seem to be that long ago. This was a retrospective study. What they found is that high dose intravenous vitamin C used on patients with COVID-19 pneumonia in severe condition, which meant they were in the intensive care unit on ventilators, that they saw very positive results and survival with using intravenous vitamin C. So it's not new. It's not alternative. We've been doing it in traditional medicine since probably before 1949. So let's talk about high dose vitamin C and cancer. So this all began with Ewan Cameron and Sir Linus Pauling. There were two publications. The original one in 1976, looking at the use of intravenous vitamin C in terminal cancer patients, and then a reevaluation of this data that was published in 1978. Both came out with the same conclusions, that high dose vitamin C prolonged survival times. Now, the doses that they used were not tremendous. They were only like 10,000 milligrams, and it was only for a relatively short period of time. And then they moved over to oral vitamin C, which is a relatively modest use of high dose vitamin C in cancer patients compared to now. So there were some concerns initially with high dose vitamin C. One of them was, what is the mechanism of action? So back in the 1970s, we really didn't have a mechanism of action. Now we know what the mechanism, or at least some of the mechanisms of action are. But this has been a major stumbling block in traditional medicine, is even though it might work, we don't know how it works, so we don't want to use it because we don't know how it works. Study design has been a real issue, in that some of the earlier studies with vitamin C and cancer, this vitamin C was taken orally, and it did not have the same results as a vitamin C given intravenously, and we'll see why in just a few minutes. And so a lot of people in traditional medicine really kind of hooked on the idea that vitamin C doesn't work if you're taking it by mouth. What they didn't take into account was vitamin C pharmacokinetics, and that given intravenously, significantly higher plasma concentrations are achieved that can never be achieved orally. It's just impossible. And in this higher plasma concentration, vitamin C becomes a pro-oxidant, and this pro-oxidant form actually regulates inflammation pathways. So if you remember a few slides ago, I said that the origins of cancer and many chronic illnesses are unregulated or uncontrolled in inflammation pathways. This is one of the ways that high dose vitamin C helps. High dose vitamin C acts as a prodrug in that it generates hydrogen peroxide in the tissues. Now, for normal cells, hydrogen peroxide is no big deal, because the cells contain an enzyme called catalase that immediately transforms hydrogen peroxide into water and oxygen. Cancer cells don't have catalase, so this is a very toxic compound that starts to weaken cancer cells when they're exposed to hydrogen peroxide. High dose vitamin C, one of the problems is that there's been a lot of negative claims in traditional medicine, which has held it back. And unfortunately, these negative claims are based on data from 30, 40 years ago, and really haven't been updated in much of the common traditional medical literature. There is a fear of the antioxidant form on chemotherapy and radiation therapy as being protective to the cancer cells, but we know that a high dose vitamin C is not an antioxidant, it's a pro-oxidant, so it actually enhances the effect of chemotherapy and radiation therapy. And this research, as I've mentioned, is all muddled because of the oral versus intravenous issues. There are also over-the-top unproven claims in alternative medicine. So if you say high-dose vitamin C in cancer in alternative medicine, you are going to get some really fanciful claims and claims of results, and it's this kind of stuff that has really stymied some of the good research that is out there. High dose vitamin C cannot be taken by mouth. You will have profound diarrhea, of that I guarantee. You will have an upset stomach, and probably not more than about 5,000 of, let's say, 10 or 25,000 milligrams that you would take is just absorbed. So most of the vitamin C isn't absorbed, causing this profound diarrhea. In intravenous administration is somewhere between 10 to 50,000 milligrams per session. There are no GI issues because you bypass the GI tract. It may transiently lower blood sugar, so I recommend for my patients to have something to eat before they have some intravenous vitamin C, and there is no LD50. What LD50 is, it's an abbreviation for the lethal dose at which 50% of the animals will die from whatever dose of what thing that is that you're giving it to them. Vitamin C doesn't have an LD50. There has not been a high enough dose found that you can give to an animal that it will cause death in 50% of the animals. So from that perspective, it's unbelievably safe. So high dose vitamin C and clinical experience, and this is my clinical experience just to give you an indication, regulating critical in inflammation pathways. I found that it worked exceptionally well for patients who have COVID or who had COVID, limiting their side effects of COVID, limiting the length of their illness. I found that the same results years ago when SARS first came out. That was a viral condition years ago. I found it to be effective as far as long COVID goes. Long COVID, I think, is involved with unregulated inflammation pathways. I use it for a lot of autoimmune disease, rheumatoid arthritis, lupus, scleroderma. Seen very good results with it. With IBS, it's phenomenal, and with cancer, I've been using high dose vitamin C and cancer for decades, and again consistently seeing impressive results with it. So what are the mechanisms of action of high dose vitamin C? Well, again, it's paradoxical. At low concentration, it's an antioxidant. At high concentration, it's a prooxidant, producing hydrogen peroxide at bare minimum. At high concentration, it also consumes antioxidants. So it consumes the antioxidant compounds that cancer cells that would affect the chemotherapy that is used in cancer cells. I've actually known some oncologists tell their patients to stop consuming any antioxidants whatsoever when they're getting radiation and chemotherapy. High dose vitamin C also modulates cancer metabolism. It actually reduces the ability of the cancer cell to make energy, and without energy, the cell dies. And it also modulates the epigenetic DNA changes. The epigenetic DNA changes doesn't change the specific gene that is in the DNA. It simply it changes the rate of expression of those genes. So cancer cells, what happens is that pro-cancer genes that are in all of us start to be expressed a lot more than they normally would, and this results in cancer. And it also has an effect on down regulating how active the immune cells are. There we go. The greatest research benefit for high dose vitamin C seems to be against cancer stem cells involving the NF-kappa B pathway. So what I said at the beginning of the lecture, now we're kind of coming full circle here. Cancer stem cells, one thing we need to realize is that solid tumors are not homogeneous. They're not all the same cell. There are a variety of different flavors of that cancer cell, that there are different flavors of it all residing within the tumor, and cancer stem cells are a small population of cells within the tumors. We only discovered cancer stem cells not that long ago, and they are the ones that really cause all the pain and suffering that we see with in patients with cancer. They are known for self renewal. They can differentiate very quickly, and they have increased to tumor genicity. They are the ones that are responsible for metastasis, recurrence, resistant to chemotherapy and radiation therapy. And in the original tumor itself, there's a network of signaling pathways that actually control the whether or not cancer stem cells get out. So until that tumor becomes big enough that it actually starts to die inside, cancer stem cells really don't have much of an opportunity to leave. That's the reason why you try to catch tumors as early as possible. So they are an important target for long-term survival and cure. The traditional approach to cancer is kill as many cells as possible, and this is done with surgery, chemotherapy, and radiation therapy. You want to catch it as early as possible because then cancer stem cells have less of an opportunity to escape. If there is any level of metastasis, if the cells have grown beyond the original tumor, that's the reason for chemotherapy. That's the reason for radiation therapy. Is an attempt to hit those cancer stem cells. It's an attempt to hit those cancer stem cells. We really have nothing in traditional medicine to address cancer stem cells, actually some of the things that we do, the surgery, the chemotherapy, the radiation therapy may actually stimulate. If it puts the original tumor under stress, and this stimulates the release of cancer stem cells. So years and years ago, I remember patients telling me that they read somewhere that if you do chemotherapy and radiation therapy, it increases your risk of metastasis. And I kind of poo-pooed it until cancer stem cells were discovered, and I went, oh, that kind of makes sense. Now that does not mean to not have chemotherapy and not have radiation therapy. It doesn't mean that. It just means that when a solid tumor is stressed, it increases the risk of cancer stem cells metastasizing. And like I said, these are the ones with increased resistance to chemotherapy and radiation therapy. Why? It's because the NF-kappa B inflammatory pathway in breast cancer is altered or mutated and may be permanently activated and overexpress chronic inflammation. This interacts with estrogen receptors and HER2 receptors and other receptors to stimulate the growth of tumor cells. It also activates immunosuppressive cells within the tumor, turning the immune system off and making the tumor actually invisible to your immune system. This chronic inflammation promotes growth and survival of the tumor. The NF-kappa B pathway expression is greatly inhibited by high-dose vitamin C. I'm going to repeat that. This pathway is greatly inhibited by high-dose vitamin C. So we can do better. Okay. So when we look at cancer stem cells in solid tumors, hypoxia is a trigger. Hypoxia just means a lack of oxygen, and yes, tumors need oxygen. And when a tumor is dying from chemotherapy or dying from radiation therapy, or it's simply dying because it's gotten too big for the blood supply, it becomes hypoxic. And this trigger simulates specific factors that amplify the NF-kappa B pathway and stimulate cancer stem cell migration. So things that we do in traditional medicine will stimulate the migration of cancer stem cells. And if you don't do anything, as the tumor gets bigger, it's going to stimulate the cancer stem cells also. So in my mind, unless you catch the tumor very, very early, you need to be saying to yourself, I have to anticipate that whatever I'm doing, some of these cancer stem cells are going to get out. High-dose vitamin C affects these hypoxia pathways, affecting the NF-kappa B and in reducing its expression, and it upregulates other cellular factors, leading to cancer stem cell death within the tumor itself and outside of the tumor. Very, very cool. And it reduces the total number of cancer stem cells that can actually be isolated from a solid tumor. Again, in my mind, very, very cool. there is a plant extract called parthenolide there's some early research in traditional medicine looking at parthenolide. Comes from an herb called feverfew. That parthenolide may have some positive effect on the NF-kappa B expression and then affecting cancer stem cells. Curcumin and green tea extract, epigallocatechin gallate or EGCG, all have similar effects. Now, how much of an effect do they have compared to high dose vitamin C? I think high dose vitamin C, from what data is out there, high dose vitamin C is much more effective. That does not mean don't add some curcumin to your food or drink green tea. It just means that you can't depend upon that as a sole factor. So let's look at the NF-kappa B pathway. In normal cells, it's a well-regulated pathway that regulates all the benefit aspects of inflammation. We need inflammation in order to heal. Without inflammation, we would never heal. But that inflammation, there is a beginning, an intensification, and then a down regulation of the inflammation. There is the induction of pro-inflammatory genes, which help to turn off inflammation, regulating immune cells and how your white blood cells actually work. When it's deregulated, such as in breast cancer, it contributes to various inflammatory diseases, including autoimmune disease and the initiation and progression of cancer. So high dose vitamin C impact is that it significantly reduces the NF-kappa B expression. It reduces cancer cell activity. It reduces these epigenetic changes in the DNA that cause the expression of cancer genes. It also rejuvenates T cell populations that are involved in going around and killing cancer cells, and it increases tumor infiltration by these cancer killing T cells, which is pretty important. It's directly toxic to cancer stem cells because of its pro-oxidant activity, hydrogen peroxide production, and the results here are really best with a competent immune system, and we see that in that high dose vitamin C makes the immune system more competent, and the more competent it is, the better everything works. So we have an increase in activity of two types of T cells called CD4 and CD8 T cells. When combined with traditional chemotherapy, it may enhance the effects of chemotherapy and radiation therapy. We'll see that in just a minute. With some of the biologics, there seems to be an enhanced activity with the biologics, and it is associated in almost all of the studies. It is associated with a lasting remission and long-term survival. Cancer stem cells, however, need support in order for them to work. They need fibroblasts, and these fibroblasts need to undergo an epithelial to mesangial transformation. We'll talk about that. And these fibroblasts have to have epigenetic modifications to their DNA to express more cancer kind of genes. So epithelial cells are actually kind of a solid structure. It's like the Great Wall of China, and they actually will prevent cancer cells from getting out because they're tightly joined and they're hard to get through. Other cells, known as mesangial cells, are quite fluid and they move quite easily throughout the body. And we need mesangial cells as a way of getting healing cells into damaged tissue. They come in and they bring a lot of healing factors. However, what can happen in tumors and with cancer cells, cancer stem cells, is that these epithelial forms are then transferred into mesangial forms, and these mesangial forms are very metastatic, and they can migrate all over the body. And it's this transformation through this chronic inflammation that we see the effect of cancer stem cells. So High-dose vitamin C will limit and regulate the epigenetic or cancer-forming changes to our DNA. High-dose vitamin C will increase collagen production by five fibroblasts, making it more difficult for cancer stem cells to migrate to make stronger walls. Okay, with more collagen. It regulates this epithelial to mesangial transformation, and that it limits it. And when that happens, and that reduces the metastatic potential of any tumor. Mesangial cells, on the other hand, increase the metastatic potential. So we don't want that. Okay, so where's the evidence? Let's just look at some of the symptoms of cancer, and what high dose vitamin C does just for the general symptoms of the illness. It improves nausea and vomiting. It improves the appetite. It reduces tumor pain, greatly reduces fatigue, depression, and enhances sleep disorders. So all without doing anything else, high dose vitamin C generally makes patients feel better as they're going through this process. But it does more than that. Study in the European Journal of Cancer, 2014, almost 18,000 breast cancer patients with about 1,500 breast cancer specific deaths. Dietary vitamin C intake statistically reduced the risk of both total mortality and breast cancer specific mortality. Dietary vitamin C, that's vitamin C by mouth. So we're not even talking about high dose vitamin C. We are talking about the perceived benefits of just taking vitamin C. Another study in 2021 in clinical breast cancer, a meta-analysis where they combined 6 studies, and what they found is that vitamin C, when given after diagnosis, and this was not a long course of vitamin C, significantly increased survival. And the same year, another medical journal, Nutrition and Cancer, showed again that post-diagnosis by the vitamin C given after diagnosis of cancer. Again, not a huge course of vitamin C, significantly longer survival and fewer recurrences. This particular study in Medical Journal Plus One, 2015. Yeah, we're just gonna bypass it. That's okay. This was an interesting study looking at chemotherapy with and without vitamin C for stage 4 colorectal cancer. What they found is that in general there was no benefit to it. However, for those patients who had a RAS mutation in their cancer, had a significantly longer survival of 9.2 months compared to 7.8 months, and you go, well, that's not really a lot, and that's what I thought when I first read this, and this is in Clinical Cancer Research 2022, but they were only given 3 days of vitamin C, so only 3 days of vitamin C resulted in 1.5 months more longer survival. To me, that's kind of important. Journal of Virology showed that vitamin C enhanced the efficacy of the chemotherapy gemcitabine against bladder cancer, which is very difficult to treat. In 1996, they found that vitamin C improved the effectiveness of doxorubicin, cisplatin, and paclitaxel for human breast cancer. 2015, they saw that vitamin C caused an increase in natural killer cells. These are cells that specifically go around looking to kill cancer cells. A lot of questions. Okay, what is the optimal dose of high dose vitamin C? It's unknown. Okay. Usually most of the studies are using somewhere between 25,000 to 50,000 milligrams per week. Seems to be prudent. But less than that seems to have effect also. How often and how long? Again, this is unknown. We just don't know enough research to be able to make that come to that conclusion. Who does this? Well, it can be kind of hard to find because not many oncologists or medical centers offer high-dose vitamin C. I know that we offer high-dose vitamin C. Dr. Block up in Skokie offers high-dose vitamin C, and I know of a couple of medical centers out west that will offer high-dose vitamin C, but not really so much around here. The cost will vary on dose. Cost will vary on dose and the location. So some places will charge more money because maybe they're in an area where people have more disposable income. I'm not sure. Is it safe? The answer is yes, but it may increase kidney stones in people who have kidney stones. And it should not be used with patients who have a liver condition known as hemochromatosis, where they hold on to their iron. Is it preventative? Some people say, should I just get this on a preventative basis? And again, we just don't know. There's just a lot of unknowns, but it seems to be overall pretty safe. So really the key takeaways here is that cancer stem cells are bad. Okay, we need to when we think of cancer, we need to stop thinking about the original tumor, and we need to start focusing on the cancer stem cells. Traditional medicine has nothing for cancer stem cells except chemotherapy and radiation, which is what we have for the original tumor mass. We know that high-dose vitamin C negatively affects cancer stem cells by a number of different mechanisms, and that high-dose vitamin C seems to be complementary to most cancer therapies. So in my mind, doing high-dose vitamin C during chemotherapy, I think that's a good idea. And I have actually seen some really excellent results in doing it that way, despite some pushback from the oncologist. So without deviation, progress is not possible. It's not possible. Thank you, Frank Zappa. So what I want to do is I want to say thank you, and I wish you all success in your health journey. Like Sue said, if you have questions, I will answer all the questions that I get, and feel free to ask me anything about this particular lecture. For more topics blending the best of non-traditional and traditional medicine, you can follow me on YouTube at my YouTube site, which is ALT MED 1544. If you're so inclined, please sign up for my newsletter or blog. I have a QR code here for your convenience, or you can visit my website at alt-med.org, or you can email me at am4011@juno.com. And I want to thank you for your time and consideration, and wish you all a wonderful weekend. Thank you.
Wow, thank you, Dr. Massey. I know I'll be emailing you a few questions. That was excellent information. Thank you for sharing the research, and thank you for putting it in a digestible format. It was very easy to follow, and wow, yeah, I'll be sending you some questions, and this is a good opportunity to remind our audience that we are not taking questions right now live, but you can email them just by using the chat bubble on your screen, and then send them to me, and then I will forward them to Dr. Massey. So just another excellent presentation. I'd also like to thank the Natural Health Research for hosting lectures such as this, and in addition to what you see on your screen here for how you can contact Dr. Massey or follow him on YouTube. Remember, you can also find information at naturalhealthresearch.org. Lots of great information there, and good resources, and it's so exciting to see this this research coming mainstream, and these alternatives to the therapies for cancer. I just love to hear about these things that are coming mainstream.
Yeah, and I can also vouch that that there is a large amount of very accurate information at the NHRI website on a whole variety of topics. They have been working diligently for many years to accumulate a large body of a very useful and immediately applicable information.
Thank you. And I also want to remind everyone that you will receive an automated email about an hour after we close here, and it will have a link to the replay of this. So I know I'm certainly going to listen to it again so I can take my notes. But with that, I thank you again, Dr. Massey, for joining us and for the excellent information. And thank you everyone out there for joining us for this information as well. Have a great day and a great weekend. Thank you, everyone.
Bye-bye now.
Bye-bye.